The first trimester of pregnancy is very delicate. As you probably know, the risk of miscarriages is very high. Therefore, preparation before and after you are pregnant is crucial to maintaining your body, physically, mentally and emotionally prepared to sustain a healthy pregnancy and baby. The first trimester is considered to be the first 13 weeks of gestation. In this trimester the hormones are changing, and all the symptoms of pregnancy begin. In this video, you'll find what you need to do to prepare for a healthy pregnancy ahead of you. Ready? Let's begin. 1. Start taking prenatal vitamins. In the first 11 weeks of pregnancy, your baby's central nervous system is actively developing, therefore it is very important to incorporate folic acid into your diet or vitamins. Folic acid reduces the risk of developing neural tube birth defects such as spina bifida in your baby. It is recommended that pregnant women get 200 mg of DHA per day to help your baby with healthy brain and eye development. 2. Time to get health insurance if you don't have one. Sooner rather than later you need to start your regular checkups. So, it is important for you to find an insurance that covers for pregnancy routine checkups, diagnostic exams, and labor and delivery, and also that covers medical attention for your baby while in the hospital, and afterwards at the pediatric doctor. 3. Choose your doctor or midwife for the checkups and delivery. If you already have a doctor that you are comfortable with, you're all set. But, if you don't, you've got some homework to do. Start your search with friends and families, or ask one of your other providers to recommend a doctor, or check out the preferred providers under your health insurance plan. 4. Make your first prenatal appointment as soon as possible. In the first visit, important things should be reviewed by your doctor, things like the history of chronic diseases that you might suffer, and if you have to take any medications for them. Also checking if there are cases of genetic or chromosomal problems in your family history, or determine the estimated due date of your pregnancy, are just a few of the many things that your doctor will check in your first visit. Therefore, the first appointment is crucial for the healthy start of your pregnancy. 5. Consider your options for prenatal testing. During your first trimester, your provider will offer to you various screening tests that can provide information about your baby's risk for Down syndrome, as well as other chromosomal problems and birth defects. A diagnostic test called chorionic villus sampling may also be offered. This is generally done at 11 to 12 weeks. Or you may consider waiting until your second trimester for the amniocentesis. 6. Get relief from morning sickness. Unfortunately, more than 50% of pregnant women will experience morning sickness at some point, mainly during the first trimester. To relieve morning sickness you can eat small portions more often. Drink fluids half an hour before or after a meal, avoid drinking with meals. Eat something light, 15 minutes before getting up in the morning. Eat whatever you feel like eating, avoid fasting. Ask someone else to cook for you. Open the windows, or turn on fans if the odor bothers you. Get plenty of rest and nap during the day. Avoid warm places, feeling hot adds to nausea. Sniff lemons or ginger, drink lemonade or eat watermelon to relieve nausea. Eat salty potato chips, they have been found to settle stomachs enough to eat a meal. 7. Choose a healthy lifestyle. This is the ideal time to start healthy habits in your routines. Habits like sleeping and resting properly. Keep stress levels under control. For this you can use meditation and relaxation techniques. Eat a balanced diet with nutritious meals. Drink plenty of water to avoid dehydration. Exercise if there is no contraindication from your doctor. I also recommend adding to your healthy habits a visit to your dentist. Women during pregnancy tend to suffer from gum diseases. So starting early to take care of your mouth is very important. As you can see, your pregnancy comes with many new things to learn and prepare. I mentioned only the most important ones for you to get ready on this new stage of your life. Remember, it's important that you remain calm, and that you learn to enjoy these moments that are unique and goes by quickly. If you like this video, share it to other mommies and subscribe to our channel.